So my role in the practice is the practice principal, which means I'm got the overall responsibility for the whole team. And my personal role within the clinical setting is dental implants. And that's the area of treatment that I'm most focused on and the treatment I enjoy providing the most. So a dental implant is a small titanium screw that goes back into the jaw. And this acts as a foundation to support your missing tooth. If you're missing multiple teeth, we can use implants to support a bridge. And if you're missing all your teeth, it can be used to stabilise a denture, to stop it moving around. So the process for a dental implant would be, we'd start with initial consultation, find out exactly what we need to achieve and what you're looking to achieve. We would then take a series of x-rays, measurements, often do a 3D scan of the jaw to really plan your treatment accurately. That's followed up with a written treatment plan, and we would then go ahead and place your implants. That's a small surgical procedure, normally takes about 20 to 30 minutes for each implant that needs to be placed. And then we leave that for a period of a couple of months to heal before we would then attach your teeth. So we get this question a lot, do implants hurt having them placed? To be honest, the experience that we've had from a lot of our patients find that pain is a very little complication of the treatment we do. They often find having the tooth out is normally worse than having the implant placed. And that's because of the process is very, very different. The biggest benefit of an implant, it's the most natural solution we can give you to having your own teeth back. It's something that's fully fixed into the jaw, so it doesn't have to be removed, and it will look and feel like a normal tooth again. The other big benefit of an implant is because it's within the jaw, it will preserve the bone that's in the area and stop you getting that sort of sunken in look that you can get. So your implant actually has a small thread on it, which allows us to screw the implant into the jaw. Once it's there, we leave it for a period of a couple of months, and the reason for that is so your own bone can go onto that implant. That locks the implant into place, and then it allows us to attach the tooth on top afterwards. With that integration that we get with the implant, it means that the implant is really solid and firm, and you're not going to get any movement with it afterwards. So when we come to the stage of making a tooth, we use digital scanners and digital technology to ensure that we get the most accurate replication of your mouth. And we also do a lot of clinical photography, which we communicate with our labs to make sure that your new tooth fits in with the rest of your mouth and looks as natural as possible. At the practice here, we also have a CT scanner. Now, a CT scanner allows us to take 3D images of your jaw, so we can look at exactly how much bone you have in the area, where nerves are, where important structures are, so we can make sure we avoid those at time of surgery. And what's very clever, we can put those images onto a piece of software, so all your implants are actually planned on a bit of software, which we can then create a draw guide from to allow us to make sure we then put the implants into the right position in your mouth. So we're not leaving anything to chance, and we want to make sure the treatment is exactly as it's planned.